Hey everyone, welcome back to Corporate Decoder, the place where we decode the secrets hidden in plain sight within corporate filings. Today we're diving into BioAge Labs Incorporated's latest report, and let me tell you, it has got some interesting developments in their quest to tackle aging and cardiovascular risks. Before we dive in, if you like getting straight to the point insights from these filings, make sure you are subscribed. We also have a Discord community linked in the description below to keep the conversation going. So what is the big news? BioAge Labs is sharing some exciting early results from their Phase 1 trial for a new drug called BGE 102, and it looks promising for reducing inflammation linked to heart disease. This report, filed on the 12th of January 2026, highlights key data released by BioAge Labs. They are announcing additional positive interim Phase 1 data for BGA 102. This is a novel drug designed to penetrate the brain, and it targets something called NLRP3, which is a protein involved in inflammation. The big takeaway is that it shows potential for being the best in its class at reducing a specific marker called hsCRP in people who have a higher risk of heart problems. Let's break down what this means. They completed a part of their Phase 1 trial where they gave different doses of BGA 102 to a group of obese individuals who already had elevated hsCRP levels. They took 120 milligrams once a day, and the results were pretty impressive. The drug significantly brought down markers of inflammation quickly. This is a critical number. By day 14, the drug achieved an 86% reduction in hsCRP. Even more remarkable, 93% of the participants reached what is considered normal levels for this marker, which is less than 2 milligrams per litre. Think about that, reducing a key indicator of inflammation by that much so quickly is a really big deal in the world of cardiovascular health. But it is not just hsCRP. The drug also showed significant drops in other important inflammatory markers like IL-6, which plays a big role in inflammation throughout the body and is linked to heart disease. It also reduced fibrinogen, which is another factor that health professionals watch closely as an independent predictor of heart events. This shows the drug is working on multiple fronts to tackle inflammation. And what about safety? This is always a big question with new drugs. The report states that BGA 102 was well tolerated and had a favorable safety profile. This is crucial because even if a drug is effective, it won't be useful if it causes too many side effects. On top of the clinical data, there is also some good news on the intellectual property front. A patent has been issued that covers not only new forms of the drug itself, but also how it specifically interacts with the NLRP3 target. This strengthens BioAge Labs' position and helps protect their investment in this technology. Now let's look at what is coming next for BGA 102 and BioAge Labs. In the first half of 2026, they expect to finish their Phase 1 trial. This means they'll have the full data from all the groups, including more studies on obese participants with elevated hsCRP. Also, in the first half of 2026, they plan to kick off a Phase 2 study. This is where they will test the drug's effectiveness as a proof of concept in patients who have obesity and are at risk for cardiovascular disease. They are planning to enroll about 100 patients. Half will get BG 102 by itself, and the other half will receive a placebo, which is an inactive substance. This will run for 12 weeks, and the main thing they'll be looking at is how much the hsCRP levels change. They'll also be checking other markers of inflammation and metabolism, and even using liver MRI scans. This is a bigger step and will give them a clearer picture of whether the drug truly works in a patient population. Then, in the second half of 2026, they anticipate having the results from this Phase 2 study. This will be a really important moment in understanding the drug's potential. In terms of exhibits, the report includes the press release itself as Exhibit 99.1. This is where all the information we've discussed today was officially announced. Now, looking at this filing from a broader perspective, BioAge Labs seems to be strategically focused on tackling inflammation as a key driver of aging and cardiovascular disease. The early success with BGA 102 in reducing hsCRP and other inflammatory markers is a very encouraging sign. It suggests they might have a strong candidate to address a significant unmet need. The fact that they received patent protection for their compound and its mechanism of action is a solid defensive move, protecting their innovation. Moreover, their clear roadmap for 2026, including the initiation and readout of a Phase 2 trial, shows that they are moving forward aggressively with the development of BGA 102. However, like any company in the pharmaceutical space, there are inherent risks. While the Phase 1 data is positive, the true test will be in the larger Phase 2 trial and subsequent Phase 3 studies. Not all drugs that show promise in early trials go on to be successful. We also need to keep an eye on the broader market and potential competition in the cardiovascular and metabolic disease space. In conclusion, BioAge Labs Incorporated is making compelling progress with BGE 102. The initial phase 1 data is strong, the patent is secured, and the forward-looking plans are ambitious. This filing paints a picture of a company pushing forward with a potentially valuable therapeutic. We'll be watching closely to see if these promising early results translate into meaningful clinical benefit for patients. Alright, that is our breakdown of BioAge Labs' latest filing. What is your take on these numbers and what they signal for the company's future? Drop your thoughts in the comments. If this analysis was valuable, hitting that like button really helps, and subscribe for more deep dives. Don't forget to check out the Discord in the description. Thanks for watching, see you next time.